Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. Um, our show is dedicated to giving you safe and effective ways of treating just about every medical condition there is in a safe and effective way compared to traditional medicine, which often comes with fast and dangerous ways of fixing things. Um, I want to always say a few things to start. One, you might want to get pen and paper in case you want to write some of the things down that I'm going to be giving you. Um, you can get it while you're listening, and of course, you can get it, since this will be up on YouTube, you'll be able to listen as many times as you like. Also, oh, by the way, my techie people tell me to tell you to please subscribe to our channel. I would greatly appreciate that. Okay? So please subscribe. I guess it's free and it's easy to do. I'm the opposite of a techie. You all probably are great at it. In it, and I want to thank first my two sponsors, PromoLife, PROMOLIFE.com. PromoLife makes ozone products, amazing ozone products that you can be using for almost, so many different medical problems. They now have ozonated glycerin. We've done a couple of podcasts on that. OG, ozonated glycerin. And they use an organic ozonated glycerin rather than what most of the docs out there are using. And it's ultra pure. It's been made in a very safe and special way. So you're going to get only the most beneficial, safest form of ozonated glycerin to take. You can use it in many different ways. In fact, I'm probably going to do a whole show just on the uses of ozonated glycerin other than intravenous uses of it. So look for that podcast coming up very shortly, along with our other lengthier ones about the science of it and everything else around the intravenous uses of it. And you can contact PromoLife at 888-742-3404, 888-742-3404. Tell them you heard about it here on Dr. Howard's show, and they may give you something special or perhaps a small percentage off in savings, etc. My other sponsor is Doctor's Biome, doctorsbiome.com, DOCTORSBIOME.com. And Doctor's Biome makes a very special 100% organic probiotic beverage, living liquid probiotic beverage. All the probiotics in there are alive, growing in number every day, eating the prebiotic that's in the liquid. Okay. The liquid is a 100% organic juice, mint, kale, lettuce, celery, cucumber, apple juice in the gut health version. And in the woman's health version, though men can take it too, they just made it a little bit different. It's in a 100% organic watermelon, apple, beet, pomegranate, strawberry juice with added cranberry. So it's highly beneficial against urinary tract infections. If you use my patient coupon code, Howard35, Howard35, you'll get 10% off the retail price. And then if you go on auto ship, you get another 10% off the retail price. So you get a total of 20% off. And you can cancel anytime. It comes with 100% money back guarantee. Actually, it's better than that. If for some reason you can't use it, you don't like it, and you call them up to get your money back, you only can get away with that once. They'll let you keep it and give the whatever you have left to someone else to try and might benefit from it. And you'll still get 100% of your money back. So you cannot lose by trying this amazing probiotic beverage that's so beneficial for so many different things. If you listen to my podcasts on it, you'll know all the different uses that it can have. And all you have to do is, look for all the shows that I've done here on YouTube that we posted on digestive diseases, disorders, and on probiotics as well. Okay, so those are that's Doctor's Biome, DoctorsBiome.com. Now, having said all that, today we're going to be talking about biomechanical orthotic devices. So if you happen to have foot problems, let's say you've had ankle sprains in the past, you have heel spurs, or you have plantar fasciitis, you could be a runner, uh, or just out for walking for exercise. You may be using Stairmasters or other things in the gym. Anytime that you're on your feet, you have to make sure that your foot imbalances are controlled if you happen to have any. Now, it's been estimated that, by the podiatry profession, podiatry foot specialists, that 85% of the population suffer from foot imbalances. I don't agree. I believe that 85% of the population may develop a foot problem for various reasons over their lifetime, but only about 15% of us are born with imbalances in our foot structure, inherited from parents or grandparents. And it can pass a generation, and you can skip a generation, and then suddenly you have good feet, or your wife has good feet, but your children suddenly develop foot problems. And if they have mild imbalances, they're going to develop these foot problems when they're early on, when they're children. I call it Robin's scale of foot imbalance. So if you're an 8, 9, or a 10, you're going to develop foot problems by the time you're 20 years old. If you're a 5, 6, or 7, now you're going to start developing foot problems by the time you're late 20s to maybe 40, 45, even 50 years old, depending upon how much standing and walking and exercising on your feet that you do. People that are living in sedentary lifestyles, working in front of a computer most of the time, that are hardly on their feet at all, might not develop problems from these imbalances that they were born with. And we'll talk about that in some of those in a couple of minutes. Then, if you're a 2, 3, 4, or 5, you're starting to develop these imbalances. Well, a 3, 4, or 5 maybe develops imbalances that have enough of an effect to change their foot structure by the time they're in their 60s and 70s, maybe even late 70s. If you have a 0 or a 1, it ain't going to matter. 0 meaning no imbalance at all, or a 1 is so mild it won't make a difference. You'd have to be on your feet maybe you're a marathon runner, that you might start to notice where you feel limited, where you might be able to do something more. A 1, 2, 3 level might develop imbalances in their 70s, 80s, 90s even, where it might not matter to you as much because you may be less ambulatory in those years of your life, unlike myself. So you can have varying degrees of imbalance in your foot structure that you've inherited. In addition, it depends on how much time you spend walking and exercising on your feet. Okay. Another factor is weight. A lot of people with very severe imbalances that are very light, their weight is ideal, or they're even underweight, don't have as much trouble as people that can be overweight. In fact, when I tell patients how much weight they need to lose, they give me a very hard time about it. Many of the people are extremely obese or significantly overweight. And when I tell them, you need to lose 8 pounds, they go, oh no, I need to lose 80 pounds. And that's hard to do. It's very easy to lose 8 pounds because 8 pounds can just be some extra water weight, not just fat on your body. But you have to understand, every step you take with an imbalanced foot structure causes stress to your foot. Now, 1 pound equals, if you understand the mathematics here, it's physics, basic physics. F equals ma. Force equals mass times acceleration. So for every pound, depending upon how fast you walk, okay, depending on how fast you walk, will have a different physiological effect on your structure. If the average person walks about 3 miles a day, they're basically sedentary. They walk about 3 miles a day. And if they walk at an average pace of about 20 plus minutes per mile, okay, the force that you're putting in is 2 to 3 times that number. So 1 pound equals 2 to 3 pounds. Now 8 pounds is significant because if you multiply 8 times 3,000 steps per mile times the minimum and average that a 60-year-old sedentary person has been estimated to walk, which is 3 miles a day. So you're taking 8 times 9, okay, and then you multiply it, okay, by 8 times 9,000, and then you multiply that times 3, you're coming up with a huge amount of force per square inch that's going through your foot and leg and into your back. Now, if you do the math and you put that much weight in gold bars, 1 pound gold bars in a room, and I tell you, if you can take that weight, those gold bars, and move it out of the room into the next room and just drop it, you'd spend your whole day trying to get all those gold bars out and you wouldn't be able to. But that's how much extra pressure is going through your foot and leg on a daily, and into your back on a daily basis. Okay, so it's 1 pound times 9,000, okay, times 3. So 1 pound is 9,000 times 3 is 27,000. And if you multiply that times 8, okay, you're getting 16 and 5 is 216,000 pounds of force per square inch in just 8 pounds of body weight. I know you can't move 216,000 pounds of precious metal from one room to another in a day. You'd break your back and you'd be exhausted before you got a third of the way through. So, but this is what your foot and ankle and your leg, your knee, your back is supposed to tolerate on a daily basis. With just 8-pound weight loss, what a difference that's going to make. Now, that can help people with good foot structure that is having those kind of aches and discomforts in their feet, the 85% of you. But what about the other 15% of you? The other 15% of you have foot imbalances that are creating bunions and hammer toes or leading to ankle sprains, ankle, hip, knee, and back problems, because your feet are the foundation of your house. And if your foundation is collapsing inward, if your ankle is breaking down inward so you have a flatter-like foot, we call that excessive pronation. That's because of imbalance in your foot structure that you were born with. And that imbalance needs to be controlled. Okay? Now, the opposite of that, which we're not going to really be talking about so much today, is a very high-arched foot structure. Unfortunately, high-arched feet are harder to help because they're very rigid and stiff. And when your heel hits the ground, it has to rock inward to adapt. And that's what the word pronation means. It's adaptation to the ground. And then we're supposed to go back up the other way and what we call supinate. And this makes the foot a little more rigid so that when we step off on the ball of our foot, we have that rigid lever to propel ourselves forward. Now, people with high arched feet or people that supinate, that don't pronate enough, they're harder to help and they develop knee, hip, and back problems very severely. They may develop heel spurs or lead to ankle sprains. They're not likely going to want to run marathons or run any distances at all. They may have problems just standing and walking. It's hard for them to take jobs where they're on their feet all the time. Waitresses and waiters and people who sell in department stores and things like that. Much harder for them to do that kind of work. Now, people who pronate excessively, rock inward excessively, they're easier to help because for them, we have what we call biomechanical orthotic devices. Inserts that go in your shoes that can help control this imbalance. So I'm reaching down to get my shoe because I didn't pick my parents carefully enough when I was born, and I inherited a mild imbalance, which I would put probably at about a 3.5 to a 4. So I started to develop imbalances as I got older, and this is what we make. It's called a biomechanical orthotic device. Now, this is a small one, and it's meant to go in house shoes. I wear them in deck shoes. I wear them in the Merrells you just saw for the winter because they don't change shoe size. This is the device itself, okay? And it's a special device that works in ballet slippers. It was originally developed for dance, and I was one of the original doctors that came up with the idea of using it in pumps and boots and slip-on shoes of all kinds. As long as the shoe has a back to it that this can stay in, Chinese exercise sandals, Bruce Lee slippers, they called them, then you can wear the gymnastic shoes. You can wear this in almost anything, and it rarely changes shoe size. Like eyeglasses for the feet, it controls the imbalance in the foot structure, so it starts me off in a neutral position. It allows for normal pronation, not excessive pronation. And thus my foot can supinate and propel me forward the right way. Well, that's what biomechanical orthotics do. Then we can make bigger ones, which I don't have a sample here to show you, but it's pretty unnecessary. It's also made out of a thermoplastic from a cast of your foot. Ideally, you're being casted. I know the doctors today and some of these stores want to use different impression materials and whatnot, but unfortunately, there's reasons why they're not as accurate and why people will have problems with it. And I have patients from 42 states and 36 countries because when I was a big name in sports medicine, I would get people in, excuse me, literally with shopping bags filled with these devices. And I'd have to say, well, guess what? I'm going to make another orthotic, except we're going to do it right. Because you have to match the thermoplastic's rigidity and flexibility to the foot's rigidity and flexibility. So for kids, you want, because they have such flexible feet, since they don't actually have a lot of bone in their feet, you want something more rigid. And then for an adult, as their foot ages and it becomes more and more rigid and broken down from the flexibilities, the excess movement that it had, you need to make a device that's less rigid and more flexible. So the key is to match all that up and then covering it with special shock absorbing materials to take away some of the pressure that's going to go through the foot into the ankle, knee, hip, and back. And when all this is done correctly, orthotics are very comfortable. So my patients are given not only the contact lenses for the feet that you just saw, but eyeglasses, big devices that they wear in athletic shoes. Of course, it's another innovation. I came up with the fact of taking the idea of taking an athletic orthotic and using it for everyday wear as well. But the big ones require intimate movement of the foot, the shoe, okay? And thus it requires laces to really hold it on correctly. And that's where athletic shoes come in. Today, you can buy all sorts of dressy athletic shoes or orthopedic shoes if you want to go that route. Um, and athletic shoes, running shoes, tennis sneakers, things like that, for walking in. And they have inner soles that come out so it easily accommodates the large orthotic, which often changes shoe size and makes you go up by half to a full size. Shoe fitting is another issue. We probably should do a whole show just on shoe fitting to help people out and understand it. But with properly made orthotic devices, we can control and eliminate ankle pain, arch pain, pain in the ball of the foot, calcium, callus deposits on the bottom of the foot, heel pain, heel spurs, plantar fasciitis, which is arch pain, prevent ankle sprains. Now, you may have a good foot structure, but if you sprained your ankle more than once or more, now it's unstable, and that's where orthotics come in by adding control and stability. They're not arch supports of any kind. You don't need to support the arch if the foot is held in its ideal position in the first place to begin moving from. So biomechanical orthotic devices are actually timing devices. Remember, a footstep is almost a blink of an eye from the time your heel hits the ground till the time you step forward. Therefore, they become a timing device, allowing ranges of motion to be normal rather than excessive and abnormal. And that's what controls all these problems and why we're able to eliminate all these problems in many patients. Again, they have to be made correctly. They have to be chosen correctly by the material choice, the cushioning, the fitting, the casting methods, and everything become very crucial in doing this. And I was fortunately blessed when I went to school by having 3 of the 4 greatest minds in foot orthopedics as my professors in school. And that's what led me to being so, and I guess, expert in making these devices. If you have any questions about orthotic devices, because they're all not created equal, you're welcome to write me at ozonedoctor, OZONEDOCTOR, at yahoo.com. Or call my office in Manhattan at 212-581-0101. That's 212-581-0101. And get your number and information, put me through to you. It's easy enough for me to do these things, and people can, we have ways of helping people who live in other states and other countries than in New York area, get these devices and have them work. I call it airmail foot orthopedics. Everybody, remember to go to PromoLife, PROMOLIFE, and call them at 888-742-3404. You can look on their website about their products. Tell them you heard about it here on the show. Remember to subscribe to my show. And remember to go to Doctor's Biome for probiotic, a probiotic beverage that is like no other on the market. I promise you won't be sorry. And that's doctorsbiome.com. Everybody stay safe, stay healthy, stay well, and we'll see you back here on Dr. Robbins' show anytime you want. Bye now.